Imagine a world where doctors, the very people sworn to protect your health, enthusiastically recommended smoking, not just for pleasure, but as a treatment, a cure, even a preventative measure. Sounds like a dystopian nightmare, right? But for decades, this was a chilling reality in America, a dark chapter where medicine and malevolence intertwined, leaving behind a trail of sickness and deceit. How could the medical community get it so catastrophically wrong, actively promoting the deadliest habit known to man? To unravel this bizarre and unsettling history, we need to go back, far before the glitzy cigarette advertisements and smiling physician endorsements. Tobacco was first introduced to Europe not as a recreational drug, but as a medicinal plant. Jean Nicot, a French diplomat, widely popularized it in the 16th century, even sending tobacco leaves to Catherine de' Medici, Queen of France, to treat her persistent migraines. It was hailed as a panacea, a miracle herb capable of curing everything from toothaches to cancer, from bad breath to syphilis. It was consumed in pipes, snuffed, chewed, and even applied as a poultice. Early pharmacopoeias listed tobacco with glowing reviews, attributing to it properties that could ease pain, stimulate digestion, and even prevent disease. Fast forward to the early 20th century. The rise of mass-produced cigarettes coincided with a powerful new advertising medium, radio, and soon after, television. With scientific understanding still in its infancy regarding long-term health effects and doctors themselves often heavy smokers, the stage was set for a monumental deception. The tobacco industry, realizing the immense power of a trusted authority figure, began to aggressively market their products using physicians. Brand after brand, from Camel to Lucky Strike, featured white-coated doctors in their campaigns, proclaiming that their particular brand was less irritating, kind to your throat, or even good for your nerves. More doctors smoke Camels than any other cigarette, screamed one iconic ad. The implication was clear. If doctors, the ultimate health arbiters, endorse smoking, it couldn't possibly be harmful. This wasn't merely subtle suggestion. It was an explicit, pervasive campaign designed to quell nascent public fears and legitimize a dangerous habit, all under the guise of medical authority. The medical community, perhaps too trusting or too easily swayed by the persuasive power of advertising, or perhaps even genuinely believing in the absence of definitive, contradictory evidence, became complicit, unwittingly or otherwise, in this grand illusion. But even as these cheerful doctors puffed away in print ads, a flicker of doubt began to emerge, a subtle discord in the harmonious symphony of tobacco promotion. Whispers of concerning observations started to circulate among physicians and researchers. Cases of lung cancer, once a rare anomaly, seemed to be on the rise. Early rudimentary studies in the 1930s and 40s from Germany and America suggested a correlation, but these were often dismissed as anecdotal or statistically insignificant. The sheer economic might of the tobacco industry, coupled with its aggressive public relations machinery, was formidable. Any scientific paper hinting at negative effects was met with fierce rebuttals, often funded by the industry itself, sowing confusion and casting doubt on the credibility of the findings. They hired their own experts to publish contrary conclusions, creating a smokescreen of conflicting data. They even started publishing their own scientific journals, giving a veneer of legitimacy to their counter-arguments. As the scientific methodologies improved, the whispers grew louder, morphing into undeniable shouts. Dr. Ernst L. Winder and Dr. Evarts Graham published a landmark study in 1950, demonstrating a clear statistical link between smoking and lung cancer. In the same year, Dr. Richard Doll and Sir Austin Bradford Hill in Britain published an even more comprehensive study, reaching the same damning conclusion. These weren't isolated incidents. The evidence was mounting, slowly but inexorably. The industry's response: denial, obfuscation, and a well-funded disinformation campaign. They established organizations like the Tobacco Industry Research Committee, TIRC, ostensibly to fund independent research into the health effects of smoking, but in reality, to control the narrative and keep the public in doubt. Their strategy was simple. If they couldn't disprove the science, they would question it. They would demand more research, perpetually kicking the can down the road, buying precious time while millions more became addicted and sick. They played on the public's inherent trust in science, twisting it into a weapon against the very truth it sought to uncover. Doctors who dared to speak out faced professional ostracization and even threats. The fight for truth became a David versus Goliath battle, with lives hanging in the balance against an industry built on addiction and deceit. The tide finally began to turn in the 1960s. The release of the U.S. Surgeon General's report on smoking and health in 1964 was the seismic event that finally shattered the tobacco industry's carefully constructed facade. This comprehensive scientific review, which analyzed over 7,000 articles, unequivocally concluded that smoking caused lung cancer and was a grave health hazard. It was a bombshell, delivered by the nation's chief medical authority, and it was irrefutable. What they discovered next changed everything. The report found that male smokers had a 9 to 10-fold risk of developing lung cancer compared to non-smokers, and heavy smokers had at least a 20-fold risk. It linked smoking to chronic bronchitis and emphysema and warned of heart disease risks. The report's clarity and authority were impossible for the industry to completely dismiss, though they tried. It sparked public outcry, leading to legislative changes like mandatory health warnings on cigarette packs in 1966 and the ban of cigarette advertising on TV and radio in 1971. This marked a turning point, a slow but steady re-education of the public and the medical community. Doctors, once champions of cigarettes, became their fiercest opponents. A generation had been misled, and the cost was immeasurable, paid in lives lost and families shattered. To this day, the story of doctors prescribing cigarettes serves as a stark, chilling reminder of several profound lessons. It highlights the immense power of corporate influence, demonstrating how an industry can manipulate public perception and even scientific discourse for decades simply by leveraging authority and disseminating misinformation. It underscores the critical importance of independent scientific inquiry, free from commercial bias, as the ultimate arbiter of truth in matters of health. Moreover, it shines a light on the human susceptibility to belief, especially when that belief is reinforced by trusted figures and pervasive advertising. Even doctors, with all their training and their Hippocratic oath, can be swayed or misled in the absence of complete, unbiased information. The fight against misleading health information, whether from industry or other sources, continues to this day. We must remain vigilant, question prevailing narratives, and demand rigorous, unfettered science. Because, as this dark chapter in medical history shows, sometimes the greatest harm comes from accepting what everyone else tells you is true, without ever asking for proof.